Welcome back. An investigation by consumer magazine Which has revealed that many dentists are failing to carry out even basic checks on patients.
In a snapshot survey of 20 dentists looking at both private and NHS dentists, over half were rated poor. Here's Lorna Ramsey.
Researchers visited 20 dentists undercover, 10 NHS dentists and 10 in private practice. They found examinations were cut short. 25% of appointments lasted less than 10 minutes. 10% of dentists spent less than 5 minutes with their new patients, and 11 minutes was the average length of the NHS visit. Basic checks were overlooked. Even though all researchers had dental problems from gum disease to orthodontic work, 25% of dentists didn't offer x-rays, which can show up tooth decay and bone loss. A massive 75% didn't check soft tissue, vital to detect oral cancer. Although more NHS dentists than private were rated poor, in the worst cases, dentists from both fields were found to communicate poorly, failing to discuss treatment options or give preventative advice.
We've got our dentist with us this morning, Dr. Uchenna Okoye. We're not saying all dentists are bad by any stretch of the imagination here with this survey, but that is quite startling. You want to have faith in your dentists, don't you?
Absolutely, and I have to say, I'm actually quite shocked by the report. It would never happen at London Smiling. At my practice, we normally spend about 45 minutes to an hour.
And should that be the standard amount of time?
For a private practice, which we are, and even talking, because I was at a meeting yesterday and talking to a lot of my colleagues, they were also shocked by it. So it's not, I'd say, standard. It's a very small sample. I think they only went to 20 practices. And I think, really, to be fair, they need to visit a lot more practices, because I don't know any dentist that spends such a small amount of time with their patients.
Perhaps the results would be even worse, though, if they went to a wider range of dentists. One would hope not, of course.
No, I don't think so. I mean, I think most dentists are really passionate about what we do. And it's funny, actually, we've just started a manifesto where there's a website called Heart Your Smile, where dentists are talking about what we want to see. We want consumers to log on and tell us what they want from us. So as a profession, and there are kind of patient groups like the British Dental Association that are working with pilot centres, focusing on the kind of things, like a full oral assessment, and that's being really successful.
So in basic terms, what would you suggest for dentists, a good practice with regards to checkups and regular visits from your patients?
Okay. I mean, I think when the viewers go and see their dentist, there's a difference between the very first visit to subsequent visits. So first visit, I'd expect the dentist to spend time with them. Time is key. The problem with, like the new contract with the NHS, it was very target focused, excuse me, as opposed to preventive focus. So, there needs to be more funding, so there's more time. So spending the time, find out what the problems are, have a look inside the mouth. I mean, I'd say start from the outside. We check the glands and the muscles, because things like cancers, we can actually spot that very early.
And you said 45 minutes sometimes you spend on that.
Oh, absolutely. Yeah, because by the time you do the outside checks, you look inside the mouth. Oral cancer is a big killer in this country. So we as a dentist can spot, if it's spotted early, we can, the success rate is fantastic. Look at gum disease. I have more patients with that as a problem than tooth decay. And most people lose their teeth from that. And, we've discovered that gum disease is actually a systemic effect. So literally your gums can, in quote, kill you, because it can be a marker for heart disease, heart attack. So, and all of this is before we even get looking at the teeth, looking for decay and so on. So, there are quite a lot of things that your dentist can spot to help your overall health.
You just have to get a dentist that gives you more than 10 minutes then, obviously.
That's the thing, that's the key. And most dentists do spend longer than that, certainly all the ones that I've spoken to. So I think this is a great report. The things that they've brought out about, the kind of checks that your dentist should do, viewers should take that on board. But we do love our patients.
And just
spend time with them.
Very quickly, how often should we be visiting a dentist?
Me personally, I think 6 months and 3 months with a hygienist. Then somebody's looking after you at all times.
Right.
Brilliant, Uchenna. Thank you.
I'm
very
doing
much.
that wrong.
I
can't tell you. I can't tell you.
Really?
No, I can't tell
Are
you.
you scared of dentists?
No, I don't know what it is. You put it off and put it
Yeah,
off for
I
no
know.
particular
Until there's a pain
reason.
in
But
there.
there is. I don't know. There's something about dentistry, isn't it?
I think it's the fact you're not in control. So I think that's why the time thing makes
Yeah.
such a difference, because if they're talking to you
There you
about
go.
it and what they find out,
Yeah.
you know, you
And not
feel
when
you're
this
taking
lady's your
taste. There you
dentist,
go.
that's
All
what
right,
you need. Yeah.
Thanks,
Thank
Uchenna.
you very
Lovely
My
much
pleasure.
indeed, yes. The headlines this